Going to give it one more minute for folks to be dialing in. We're just at 9:30, and then we'll get going. Okay, let's get started. Good morning. For those of you I've not met yet, my name is Kathy Kaufman. I'm a principal with Health Management Associates, a national health policy consulting firm. I'm based in the Portland, Oregon office, and myself and a number of my colleagues have been working with BHT over the past few months, getting ready for exactly this. So today, we are going to walk through the review process and timeline. I understand that we've got our volunteer review panel on the line today, so we'll walk through what BHT is asking of you and when and how. We'll walk through the review guide that we developed for the transformation plan reviews, and we'll answer your questions. So we can keep this really informal. Feel free to ask questions as we're going through. You don't need to hold them until the end. Okay, so for the volunteer review panel, Hadley is going to be sending your review packets out on Wednesday. You'll have forms that you can fill out for the review of each plan. You'll need to save each completed review form with the name of the partnering provider and your name. So I give an example. If I reviewed Multicare's plan, I would save it as multicare.kathyk, just some way for us to know which partnering provider plan is it that you reviewed and which reviewer. Completed forms are going to get saved into a Dropbox folder that Hadley is setting up for you. You'll get a link from Dropbox and or Hadley later today for that. And the ask is that all reviews need to be completed by no later than close of business on Wednesday, August 22nd. There is a big debrief on August 23rd and 24th with the BHT team, and it's really critical that those reviews get in before that two-day meeting. So before we get into the review form and the guidance, just a couple of basics to know. So there are two versions of this form. There's a long one that's got more detailed instructions about what each question means and when it comes to rating things, how to use the scale. And then there is a shorter version that is just for quickly capturing your responses. We're going to walk through the long form today. Both of these forms are electronic forms, which just means they're meant to be filled out online. You'll see little gray boxes anywhere you're supposed to put a comment or a rating or check a box. So they won't work well for printing out and filling out by hand. My advice would be start for the first few plans that you review, use the long version, or at least have a long version printed out to look at as a guide. But once you get used to the rhythm of the review and the questions, you'll probably want to switch to the short form because it's just going to be easier to scroll through. It's half the size than the longer form. Okay, so let's take a look at the form. Starts off very easy. We just want to know which reviewer, put your first and last name, what plan you're reviewing, which partnering provider, we're looking for the organization name, and then in which collaborative is the partnering provider participating. And we know that there are some partnering providers who participate in multiple collaboratives, but you should have a separate plan for each collaborative. So this is, you should only be checking one box for any plan that you're reviewing. So the questions in the form mirror the questions in the transformation plan template. So the template begins by asking partnering providers to talk about transformation leadership and oversight. So that's exactly where we start with the review form. Your first question, does the plan have sufficient transformation leadership and oversight? This is split in, this is a two-part question. The first part is about having a transformation manager, is what we call the position, and governance in place. And we just want to know if yes, you see that an experienced person is identified as the project lead, they've outlined a governance structure and lines of communication and accountability. No, you don't see those things identified, or something in between. You see components, or you see things identified, but you have questions. And if you rate this as either a partially or a no, then we just ask that you add some comments and let us know why. It can be very brief. Just give us enough information to know what prompted you to say that this was not a yes. Same thing for a quality improvement capacity. Quality improvement, we want to know, do they have data about performance relevant to Medicaid transformation? Are either a group or staff identified to have the QI function role? Is there a governance body for reviewing data or working across the organization? Are they talking about adding new QI capacity to support the new activities identified in the transformation plan? So these are just examples of the kinds of things that you would see in a response. And it's the same kind of yes, partially, or no. Yes, you see a really robust answer. Partially, you see some of these things, but it's unclear, you have questions, or no, the capacity is just not identified, or they're telling you they don't have QI capacity. Next, we ask the partnering providers to provide an overall equity statement across all of the work and for their organization. And this is just a yes or no. Yeah, you see an equity statement. It's difficult to rate an equity statement. So we just want to know that yes, there is one. It's actionable. It seems like a reasonable equity statement. Or no, there is no statement, or the statement has no bearing on Medicaid transformation or the region's needs. Number 3, does the plan include a clear community-based care coordination plan? So we've made the response here either a yes, it meets expectations, or no, it doesn't. And the reason for that is because much of the community-based care coordination work we see is really happening at the collaborative level. And so it's very difficult for a provider to have a concrete plan about how the provider will work with the county, the collaborative level community-based care function before that function's really been identified and fleshed out. So in other words, we're not looking for, extreme level of detail, but we want to see that there is a plan in place. Community-based care coordination is a function that is being thought through and taken seriously. The plan identifies a target population, takes into account existing community linkages, gaps, and some indication of how the partnering provider will work with Pathways hub pilots in their counties. So either you see most of that, or you don't, in which case you check the plan does not meet expectations. Okay, so those are the overview questions, and now we're going to move into the review of the 3 core areas of transformation reflected in these plans: bidirectional integration of care, chronic disease, and opioids. Any questions about the overview questions before I move into bidirectional integration? Okay. Oh, I hear somebody.
Kathy, this is Diana. I have a quick question.
Yeah.
About the community-based coordination. If, for example, because this could answer the question too, if, for example, the responder just outlines who their partners are going to be, but doesn't talk about a broader plan to engage others, would that be sufficient? Would that meet expectations? And it doesn't talk about pathways, but it says these are our 3 partners.
Yeah, I would rate that as it doesn't meet expectations, because it's great that partners have been identified. It's a start, but it's really not taking the shape of a plan.
That's what I thought.
So that's a really good question, but let me just take that, let me just say to everybody, all of us on the HMA core team, BHT staff, and the volunteer review panel, I think the way, we've got a lot of eyes doing the reviews. So, and a lot of eyes with lots of different perspectives. We have clinicians helping to do the review. We have people who've, stood up similar efforts in other states and have real on-the-ground experience. We have folks who are bringing other perspectives to the table. So my guidance to everyone is use your own judgment and your expertise. Don't worry about getting it wrong. Do what you think makes sense based on the guidance you see in this document. Obviously, if you have any questions, we're here to answer them for you and help you think through them. But don't worry about getting it wrong, because every plan is going to get reviewed by multiple people. So if something gets misread, there are going to be, if you, for example, check this plan doesn't meet expectations, but maybe it really does based on the rubric we're using here, there are going to be 3 or 4 other people who are reviewing this exact question for that exact partnering provider. And we're going to put all of it together. Okay, so bidirectional integration of care. So the first area of transformation. So you'll see that across the 3 areas, bidirectional chronic disease and addressing the opioid use crisis, there's a very similar format and approach to reviewing all of this. So same questions across all of the areas. The first question for each area of transformation is, does the plan provide at least 2 specific aim statements for the models or the interventions they've selected? And this is a yes or a no with some guidance on what an aim statement is. It should, the best guidance is the first sentence here that says there's a statement that answers the questions what, for whom, by when, and how much. And that's, the goal here of asking partnering providers to provide at least 2 aim statements for each area of transformation is to make sure that we understand what it is they're trying to achieve through their transformation plan in each area, and also make sure that it's clear to the partnering provider in a very concrete way. Then we get into the review of the actual plan part. So we're asking that folks use a scale of 1 to 5, 5 being excellent and 1 being poor or inadequate. We'll use this scale, same scale, throughout all the areas of transformation. And the way we've structured this lines up with exactly how the partnering provider transformation plan template is structured. And that's just, you have a table with all of the elements within the model. Partnering providers are going to be providing information in their plans that talks about their existing capacity in any of these areas, and then what their plans are with the transformation project dollars. And we're going to ask you to rate the plan on a scale of 1 to 5, and then add some comments. Comments are going to be helpful regardless of what rating you give in any section, but they will be especially helpful if you give a very poor rating. So in any area where you rate a 1, it's really important that you share your thinking about what was insufficient or inadequate about that plan. Because of course, what we'll do with these reviews, what BHT team will do with these reviews is make recommendations to waiver finance and the board about funding, and also go back and talk with partnering providers about any gaps in their plans. So for bidirectional, partnering providers are asked to pick either the BRIE collaborative model or the collaborative care model. So in all of your plans, you'll see one table is filled out and one table isn't. There may be some providers who are going to do a blend of both models. That's fine too. The partnering providers, if a partnering provider picks the BRIE collaborative model, it is not required that they address every single element in the BRIE collaborative model. A partnering provider might say, I'm going to really focus on developing an integrated care team and the accessibility and sharing of patient information. And so, you might see blanks in some of the other areas that are components of the model. That's okay. You're going to rate that will just be an NA for an element that's not addressed, and you're only going to rate the areas that a provider has developed a plan for. So for bidirectional integration of care, the options are the BRIE collaborative model or the collaborative care model. You'll just fill out the table connected to whichever model the provider picked. And then after you do the rating across each element, we'll ask you for an overall assessment of the plan as a whole instead of piece by piece. What do you see as the key strengths and or weaknesses? You don't need to write a thesis here. It's really bullet points are fine. It's just share with the other reviewers your overall assessment. And then next question is, does the plan include a concrete plan for working with partners in the region? And that just really comes down to, has the partnering provider identified other organizations or providers in the area with which it's going to work? Is it just naming partners, or is it actually talking about, we're going to work with X organization and they're going to provide community health workers? Is there a specific about the role in the relationship? That's a yes. If partners are discussed, but it's unclear how they're actually going to work together, that would be a somewhat. And then a no if partners are not identified. Okay, I'm going to go through the couple of remaining questions for bidirectional, and then I'm going to pause again for questions and make sure this all makes sense. Oh, that was the last one, actually. There should be, that's 8. Am I missing a 9?
There's a 9, does the plan include concrete plan for
so sorry, this slide cuts off. There is a question number 9 around, actually there are 2 more questions, 9 and 10. Does the plan include a plan for equity specific to bidirectional integration? And does it have a sustainability plan for bidirectional integration? I'm going to flip really quick, apologize for hurting your eyes, because they're the same questions that we see in chronic disease. So 9 and 10 for bidirectional are, does the plan include a concrete plan for promoting equity and bidirectional integration? And then also for sustainability. And again, it's a yes, somewhat, or no. Go back. So before we go through chronic disease, any questions about this section? Okay, and again, the best thing to do is use this guide, take a plan and see how it works, and questions may come up, and feel free to email me. I've got my email at the end of the slide deck if you've got any questions in the middle of a review.
I have a question about equity. Are you defining that, or are we just using our best judgment?
Yeah, let's look at what we structured. So for the most part, you are using your best judgment, but here's what we asked for: concrete and specific. So the way to think about it, it's entirely, I would expect that there will be room for improvement in everybody's plan, right? This is the initial plan, and it's unlikely that anyone is going to get it 100% right either in their plan for addressing equity or their plan for sustainability or their plan for working with partners. So I think what we're really evaluating, we certainly want your judgment around the strength of the plan, but a lot of what we're evaluating for in this review, in this phase, is do they actually have a solid plan? You know, are there actual concrete, are they just talking about equity in general? Equity is important, we want to reduce disparities, but they don't give any concrete plans for how they're going to contribute to making that happen. I think that's what we're looking for in this review. So the guidance here is, you know, are there concrete activities identified? Are they just vaguely addressing it, but you're not sure what it is they're actually going to do? And, or is it a no, where this equity is just not addressed, and maybe the plan is saying that, you know, that they don't intend to address equity through their efforts. Does that make sense?
Yeah, thanks. That's
okay.
helpful.
Good. Okay. But bring your own, we want you to bring your own judgment to it, because that's the value of having so many different perspectives around the table in this review, and we'll put everybody's perspectives together to get the best evaluation of each of these plans. Okay, so for chronic disease, the very, you know, exact same format as we just saw for bidirectional. Do they have the specific aim statements? For chronic disease, there's just one model, so there's just one table, but there's a lot of things in each of the elements for this model. So again, you're going to rate the provider on what components they're choosing to do in their plan, not are they doing every single bullet that's listed in each element for the plan. So chronic disease, I don't have all of the elements in the slide deck here, but I think there are 6 or 7 elements for chronic disease, if I remember. 5 elements for chronic disease. Then at the end, again, what's your overall assessment? 6, what's your overall assessment of the plan? Help us know what you see as the key strengths or weaknesses. Definitely want to see a concrete plan for working with partners specific to chronic disease, and also the equity and sustainability questions. For sustainability, you know, I think sustainability requires a partnering provider to predict the future, which, you know, is always a shaky thing to ask someone to do. So, you know, I think we want to see a concrete, reasonable plan for sustainability, not something that's pie in the sky, but something that seems realistic. Even if things change over the course of the project and the original sustainability plan is no longer a feasible one at some point, it's really important that partnering providers be thinking about sustainability on day one. So what we're grading for here is really just, do they have a concrete, reasonable plan? Okay, so the opioid section is the most cumbersome, I guess I'll say, because there are 4 tables in the opioid section. There are 4 levels of intervention. They're not models, it's just 4 levels of intervention the state is asking for. It is not necessary, just as with the other sections, for a provider to have plans in all 4 levels, or to even be addressing each and every activity or strategy within each level, or even within each element. The opioid models that are identified, or strategies that are identified, are pretty detailed, and there's a lot packed into some of these boxes. So again, you're just going to rate on the plan that's provided, the areas that are addressed, not the ones that aren't. So the 4 levels are, there's a table for prevention, a table for treatment, a table for overdose prevention, and for recovery. And then again, the same questions. What is your overall assessment for the plan? Another thing I want to call out is that we're asking for this rating, but we aren't going to be adding these scores up. It's really a way to get at the strength of the plan in each of the areas. So don't worry about what the overall score is going to be for each area of transformation, because we aren't going to use the rating system in that way. We will use this question, what is your overall assessment of everything together, as more of a guide to the overall strength or weakness of a plan in a particular area of transformation. And then same questions as for the other two: concrete plan for working with providers, concrete plan for promoting equity, and a reasonable sustainability plan for the future. So that wraps up really the plan part. For plans that are coming from primary care providers only, there are these two questions about LARC strategy and increasing access and utilization of fluoride varnish strategy. And it's simply a yes or no. First of all, does this apply? Do they have a strategy? And then if they do, are there concrete activities planned, or is there just a general statement, but you don't have any concrete activities? There's no actual plan yet. They're just sort of saying like, yeah, we'll try to increase patients' knowledge of LARC, but they're not telling you how. And the same with fluoride. And then, this is the last two questions, your overall review of the transformation plan as a whole. Everything that you've rated, what is your overall sense? This question might be harder to answer in the beginning and easier to answer as you review more plans. You can always go back and look at how you rated your first few to see if it lines up with how you started rating plans as you read through more of them. We're asking for your overall impressions. Is this excellent? Is it good? Does it need improvement, or do you have serious concerns? And then we've got a section here for your overall comments. If you've got a plan that's really strong, you put comments in other areas, you don't have to fill this section out. But, you know, again, particularly for plans with any areas of weakness or those that have some serious gaps that need to be addressed before it can even be considered for funding, we'll positively want to get your comments about that in this section. There is, as I mentioned, a short form, so you don't have to keep scrolling through the big long form with all the guidance. Once you get down what's intended by the questions, the short form is a lot faster and easier to navigate. Here's the example of what the tables for bidirectional integration look like. Much easier to fill out than going through the table that has all the narrative about what each of the elements means. And that's it. So hopefully that feels doable. I know the timeline is tight. We are all sharing in the same pain between now and August 22nd. But any questions that you have right now?
Those forms are on the Airtable.
Hadley and BHT team, did I miss anything?
I don't think so. Just as a quick update from us, my plan is to send out, a packet to each of our volunteers to review with just a packet of your plans that we're going to ask you to review. You'll get that sometime on Wednesday. I'll include in that email a link to the recording of this webinar, the slides, and all of the review sheets, so you have everything in one email. And otherwise, if anybody has any questions, for folks here in the area, we have some times where we've held our office conference room open in case anybody wants to swing by the office and use our space to do some reading and reviewing. Otherwise, just feel free to work on your own time and let us know if you have any questions or come into any struggles.
Kathy or Hadley, this is Brian. Are we going to be getting just specific plans, say, on bidirectional integration, or are we expected to review all the plans from one provider?
Great question, Brian. Thanks for bringing that up. We had originally talked with some folks, I think especially the Provider Champions Council members, about breaking up the plans by section. Ultimately, what we figured out was with the number of plans that we had submitted and the number of reviewers, it was going to be way too much of a burden to split the plans anymore. So we are now asking that each reviewer reads the entire plan.
Yeah, how many plans were submitted, just to get a sense of the number?
I think the exact number was in the low 50s.
Okay.
We had 46 unique organizations submit plans, and a few of those had multiple plans for different counties.
And if an organization didn't submit a plan in a certain area like opioids, we just skip that one for that organization? Is that the idea?
Yep. You'll probably find that, for example, a lot of the behavioral health plans didn't comment on the chronic disease section. So there will definitely be some partners who don't answer each plan or each project.
And we just leave it blank.
Yep.
Okay.
Hadley, about how many plans is each reviewer going to review?
To be totally honest, I haven't tallied the final number of reviewers. Anybody in the room know what we have?
9 or 10?
I think we have about 10 volunteers who signed up to review. So my hope is that we can get it down to each of you. We're still recruiting a few more. We're trying to get a couple more stragglers. If you all have any friends who you haven't hassled into joining the volunteer crew, please do. It will help you all. And we're hoping to make sure that no one's reviewing more than 10.
Okay, thanks.
One last question, Hadley.
Sure.
Hey, you still there? So if we have a conflict in reviewing a plan because of some relationship, is there a place to call that out, or do you want us to
Yes.
send it back to you, or how do you want us to deal with that?
That would be perfect. We, just based off our understanding of all of your, working relationships, we are doing our best to make sure nobody gets assigned a plan that is from an organization that they work with. I know that there are a number of you, especially folks on the Provider Champions Council, who may have given some input on some other folks' plans. So if by chance you do get a plan that you feel is not appropriate for you to edit, feel free to just send it back to me, and then we'll reassign those.
Great.
This is Luann Chen from Community Health Plan. I think I might have missed, I was driving from Snoqualmie Pass, so I might have missed, when are we getting these reviews to do, and how many will there be for each person?
We are going to send them out on Wednesday. Everybody's going to get a packet. There's still a couple folks who have not submitted their plans, and we've given it just a few extensions to people. So we don't have all of the plans in yet, so which is why we're waiting till Wednesday to send them out to all of you. I expect that every volunteer is going to be reviewing our goal is between like 5 and 8 plans.
Okay, good. Sounds like fun. Thank you very much.
So if it's helpful and folks are having challenges or just questions with the review form, the HMA team can hold office hours on Monday or Tuesday, after you've had a few days to look at them and do some reviews for any questions. So we'll work with the BHT team to get out our availability for that in case it's helpful to you.
All right, it sounds like there aren't any more questions. So if anyone needs anything else, please feel free to reach out to me or Kathy. And other than that, you'll hear from us on Wednesday with your packets to review. Thank you so much for agreeing to help out with this. It's a really big help to us.